this evening's online career meetup event focused on careers related to healthcare, psychology, sociology, and human relations. This has been a pretty busy semester for our team, certainly, as well as our students and alumni and our guests. And we're enthusiastic because tonight is kind of the conclusion of our spring programming. So let me just share a big thank you to Kelsey Richardson, our Senior Career Advisor, as well as Nikita Cassidy, our Data and Administrative Coordinator in Career Services, really for their amazing, tireless work to put together this evening's event, and certainly their efforts for everything that they do for our students and alumni. So before we begin the event, I'm going to go over a couple of housekeeping items, just so everyone understands sort of what we've gotten ourselves into. The format for the evening is a mixture of a networking event and an online job fair / information session. So here's how it works. First, our employers and industry representatives. We have 7 here this evening. Each of them will speak to the group as a whole for 3 or 4 minutes, providing an overview of their organization and the career opportunities and the culture, or simply their own story. Then all of you as participants will be moved into small group breakout rooms for the networking portion of the event. And then what we'll do from there is we will place the different employer representatives into each of the breakout rooms. So they'll have about 5 minutes to talk more directly with you and your small group. And then each time the 5-minute sessions are up, we will move the employer representative to the next breakout room, and so on. So through that, attendees should have an opportunity to ask questions, get to know more specifics about the organizations during the breakouts, and it should run quite smoothly. We do have quite a few people here this evening, so remember to be thoughtful and deliberate and brief with your questions and comments and respectful of one another's time. We will do a collection of resumes from our attendees and share those with the representatives following the event. So if you don't get as much individual contact as you would like, please keep that in mind. This doesn't need to be the end of your connection. Think of it more as the beginning. It's certainly a unique approach to networking and facilitating connections, but it's worked pretty well for us, and we're excited to get started. Lastly, before we move into the portion with our speakers, I just wanted to mention that if anyone has questions or comments or any issues during the event, please reach out to us via chat and we'll do our best to address them. Okay, with that, we will go ahead and get started with our individual organization presentations. The first of those, I am looking at my colleague from Comprehensive Behavior Support, Lucia Miller. Take it away, Lucia.
Thank you. Hi, everybody. I'm Lucia, and I work for Comprehensive Behavior Supports. And so I'm going to tell you a little bit about, I guess, what we do. And then after that, I'll tell you a little bit about what I do with the company, just so you guys have a better idea of my position. So at CBS, that's what we call it for short, we actually provide home-based services for children with an ASD diagnosis. So we provide ABA therapy, applied behavior analysis therapy, and we specialize in in-home services. So the way it works with our agency is we find you cases that work with your schedule, that are super flexible with your availability, and we set you up with a case that's local near you. So wherever you're located, we try and find you a case within a certain, however far you're willing to travel, and you would work with the clients one-on-one to help them reach certain goals. It really is applicable to students who are particularly interested in education and psychology, because A lot of the foundations of ABA therapy are based in many of the psychology principles that we learn in as like with a psych major, because I graduated with a bachelor's in psychology. So, and then, yeah, that's really kind of what our agency does. We provide training for you as well. So we provide training to help you get into the field as well. So to learn about the different principles and how to, provide ABA therapy. And the cool thing about this is there's really no credentials required for it. So there's no specific bachelor's degree that's good for it. There's no specific degree that's good for it, which is also pretty awesome. At the agency particularly, I specifically work for outreach and getting our name out there. So I do these events, and we have specific individuals in the office who deal with placing you on cases based on your location. So that's really what I do, and that's what our agency does.
Thank you, Marcia. It's great to have you with us. I'm sure our attendees look forward to learning more and speaking with you directly in the breakout. So now we'll go ahead and move to our second speaker for the evening. I am looking at Shanice Connor-Boone. We are thrilled to have you, especially if you'd like to share a little bit about your particular connection with CUNY SPS.
Yeah.
I will turn things over to you now.
Thank you. So my name is Shanice Connor-Boone. I am a talent acquisition specialist at 1199. If everyone knows 1199, we're a healthcare union. I am a graduate of class of 2021 during COVID. My master's is in business leadership and management. I've been in HR for about 18 years or so now as a generalist, but right now I work under 1199 with recruitment. So we currently recruit for all positions in the hospital, anything from entry-level positions, housekeeping, dietary, transporters. So kind of gets the students in the door if that's what they want to do, all the way to professional positions we receive. And my goal today is to hopefully have students, even if they're still in school, if they want to try an entry-level position, it can be a clerical position they're interested in, and then they can always internally move around once they're in the institution. We work similar to an agency. So I work with different facilities in the Bronx and Westchester. I would say Westchester and up because we do get facilities in Orange County, Putnam County, as well as Rockland. And in our office, I specifically work in the Bronx, but we do have other offices in the 5 boroughs as well as Long Island. Let's see, what else today? So, I mean, like I said, I'm a student there. One of the greatest benefits that I have being with working for 1199, as well as if you worked in 1199 in the hospital setting, you get tuition reimbursement. So my master's was paid for by my organization. So that's one of the greatest things that I have accomplished in the past couple of years since I've been here for 8 years. And I'm looking forward to meeting with the students today and kind of giving them a little bit more of my story they're asking, as well as talking about positions and opportunities that we have available.
Thank you, Shanice. It's so nice to have you here. It's wonderful to have our alumni sort of come full circle. So thank you for being here.
No problem.
I'm sure our participants look forward to learning more about 1199 and about the career opportunities there. So at this point, we are moving to our colleagues from the New York State Office of Mental Health, Heather Martin. Heather, take it away.
Great, thanks so much. So, hi everyone, my name is Heather Martin. I'm an assistant director here at the New York State Office of Mental Health. I work in human resources. And so the New York State Office of Mental Health is a state agency, and we operate 23 psychiatric hospitals throughout the state of New York. We have facilities that are on Long Island. We have facilities in the New York City metro area. We have facilities that are in the like Westchester area, as well as the Capital District, the North Country, Central New York, the Southern Tier, and Western New York. So our facilities provide mental health services to adults, to children and youth. And we also have a very large forensic system where we have inpatient forensic hospitals, as well as we are embedded in the Department of Corrections prison systems. We have mental health units within all of the prisons. So when you look at us as a whole, when I say inpatient facility, we're a hospital. And so anything that you would need to run a hospital, we employ. Doctors, nurses, direct care staff, social workers, psychologists, administrative support services, cleaners, food service workers. That's just the beginning of the opportunities that we have available. We provide inpatient, like I said, and outpatient services. Our patient population is the severely mentally ill. And so we're really looking for individuals that align with our mission, which is we serve the underserved. So those that have been marginalized, those that have been unserved, as well as underserved. One of the biggest programs that we're working on right now happens to be in the New York City area, which is we're working with the homeless population. And we're looking to take them, bring them into our facilities, stabilize, give them the skills to be able then to reintegrate into the community and ideally in a residential setting. So I'm really looking forward to speaking with everyone in the breakout sessions, and we can certainly get into the details of the positions that we're looking for.
Thank you, Heather. It's nice to have you here. I appreciate the explanation of the system. I think I know from being in an organization like CUNY, sometimes it can be a little difficult to understand these large agency type organizations. So thank you for that. We look forward to learning more in the breakout room. So now I'll go ahead and move to our next speakers. We have two representatives with us this evening from VNS Health. Let me turn things over to Sharon D'Amelia and Ashley Smith.
Hi, everyone. It's so nice to meet all of you. I'm a talent acquisition specialist from VNS Health, and I'm here with my colleague, Ashley Smith. And we both actually recruit for the nurse residency program, but VNS Health does offer many opportunities for everyone. We've been around for 130 years. Our former name was Visiting Nurse Services of New York, and we changed our name about a year and a half, or maybe 2 years ago, to VNS Health. We serve all 5 New York City boroughs, Westchester County, and Long Island. And we are a home care agency. So our nurses are traveling and visiting patients in their homes. We also have other professionals like social workers, PT, OT, speech that also are going into the homes. Something that all of you may be interested is our summer internship program that we are recruiting for. It's a great opportunity for entry-level positions for anyone interested. Ashley, do you want to add anything?
Yes. So there are a plethora of opportunities at VNS Health, and a lot of benefits that one can tap into once becoming an employee, such as tuition reimbursement, a very generous PTO policy, as well as other wellness resources. Specifically, the nurse residency program, as Shannon said, is where I recruit for, where my focus is. And our nurse residency program is a 2-year program catered to nurturing a new RN into the field of nursing. So you have 2 years of support, just learning the ropes, kind of not getting just thrown into the field. You work with a preceptor, as well as the rest of a cohort of maybe 5 to 10 nurses. Basically all learning at the same time, gaining your skills in nursing to provide home care by the standards of New York State. And for anybody who is interested in our nurse residency program, we'd be happy to talk to you about it. But there are also opportunities for LPNs, seasoned RNs who have several years of experience and beyond.
Thank you, Sharon. Thank you, Ashley. It's nice to have both of you here. Really wonderful the way we've been able to keep a strong connection with VNS Health. So thank you again for joining us. Okay, so we'll go ahead and move to our next presenter. This individual comes to us from Care Design, New York. Let me find a little box there. Andrew Mitchell, take it away.
Yeah, so my name is AJ. I work for Care Design New York. We are a CCO, or a care coordination organization. We work specifically with folks with intellectual and or developmental disabilities, assisting them with connecting to whatever kind of programs or services they need. Say, for example, VNS Health. The work that care managers are doing is fundamentally case management. So folks will have a number of folks on their caseload. All of them will have a qualifying intellectual and or developmental disability. And then we will assist them with connecting to whatever services they need. It's a lot more holistic than a lot of other positions. You could be connecting folks to medical services. You could be helping them connect to IDD programs, ARCs, Saratoga Bridges, YAI, you name it. There's about 1,000 different ones throughout New York State. And then in addition to that, we're also helping them with kind of whatever their life goals are. The fundamental work of a care manager is to create a life plan, and that life plan will really kind of dictate what it is that an individual wants, and that puts into play kind of all the folks involved in their care so they're able to get the services they need. We serve about 30,000 folks throughout New York State along the entire eastern portion of the state. I say from Plattsburgh to the tip of Long Island is the area coverage that we have. The vast majority of folks that we support, just because that's where the most people are in the greater New York City area. So we operate throughout the metro area, Long Island, Westchester, and then again, Poughkeepsie, Plattsburgh, Albany, that whole area. The work that care managers do is a mixture of remote work, working from home, and then also traveling to meet with the folks on their caseload directly. So for anyone that's in this position, they can expect to have both a opportunity to connect with folks wherever they are, as well as the opportunity to work from home. That's the vast majority of what we recruit for, but we also have all sorts of support departments. Caring for individuals with IDD can mean a lot of different things. Some of the folks that we support live independently, drive, get married, lots of independent things, and then plenty of folks also require 24/7 services. So those folks, we tend to do a lot more of helping them connect with other programs or medical supports they need. So the position itself can be a lot of different things depending on who's on your caseload and what they're going through, which for me, I think is something that's kind of a benefit. You're never doing the same thing twice, and you're also always learning something. But that's fundamentally who we are and what we do. And I'll be happy to answer any more questions about the organization. I'm a recruiter. So my job is to talk to people and try to get them interested in working with us. So hopefully you've done a little bit of that.
Thank you, AJ. It's nice to have you with us as well. It's good to hear about what the organization offers, and I'm sure our participants will be excited to talk more with you in the breakout. Our last organization that we have represented this evening is Scribe America. Let me find. Okay. I will turn things over now to Seth Macy. Hi,
Hello.
Seth.
Yep. Hello. I'm Seth Macy. I'm a senior medical scribe in the emergency department and also Jefferson Urology, male reconstruction. So our company is based on recording for the electronic health record, as well as working with physicians, making sure all their notes are properly documented, as well as making sure that their workflow is going as optimally as we can make it. We do offer virtual and in-person settings. For me, I work in person here in South Jersey, and I do virtual maybe 1 or 2 times a week. out in Philadelphia. We employ 25,000 scribes across all 50 different states, with about 50 different medical specialties, primarily in emergency medicine, but there are outpatients such as primary care, urology, cardiology, and so on.
Thank you, Seth. We appreciate you coming and representing Scribe America. I'm sure there'll be more that you can share with our participants as we move ahead. So at this